What if your blood sugar numbers improve, but the disease underneath continues to progress? Welcome to a deep dive into the Diabetes Code by Dr. Jason Fung.
Right. And today we'll explore 5 evidence-based reasons why lowering blood sugar isn't always enough, and 3 practical habits that support genuine metabolic healing.
Yeah, our mission today is really to help you distinguish between, just controlling symptoms and actually restoring genuine metabolic health.
Exactly.
Yeah.
Which is so incredibly important. I mean, especially after the age of 40 when our metabolisms really start to shift.
I always just assumed my annual blood panel tells the whole story. Like if my A1C is fine while my doctor is happy and I'm totally fine.
Right. But Dr. Fung argues that it's basically a total illusion. It forces us to rethink how we view disease entirely.
Wait, an illusion? How so?
Well, because high blood sugar is just a symptom. Think of it like a fever, right?
Yeah.
If you have the severe infection, your temperature spikes.
Oh, I see. So the fever isn't the actual disease, the infection is.
Exactly. And in this case, the underlying disease is insulin resistance, not the blood sugar itself.
So treating just the blood sugar is like, I don't know, taking a massive painkiller to lower a fever while completely ignoring the infection causing it.
Yes, and that actually sounds incredibly dangerous when you frame it that way.
Yeah.
Chasing normal lab values with medication alone just creates a dangerous false sense of security.
Wow. So I'll see normal numbers on my lab results and think I'm perfectly healthy, while the real problem is quietly getting worse.
Right. You just keep doing what you're doing, assuming the medication solved the issue, but the underlying insulin resistance is, well, it's still progressing in the background.
And I imagine it gets worse when we look at how we force those numbers down, right? If the core problem is insulin resistance, pumping the body full of more insulin to lower blood sugar feels backwards.
It is entirely backwards. When you pump extra insulin into a body that's already highly resistant to it, you're just forcing glucose into cells that are already crammed full of sugar.
Is it basically like giving alcohol to an alcoholic to stop their withdrawal shakes?
That's a perfect analogy, yeah. I mean, the symptom goes away temporarily, but their liver continues to fail.
Yikes. So it just drives further weight gain and like worse hormonal imbalance.
Exactly. The result is that the cells become even more resistant.
Wait, if the cells are already stuffed tight and the medication forcefully clears the sugar out of the bloodstream, where does it actually go? It doesn't just vanish.
No, it doesn't. The standard drugs basically sweep it under the rug. Since the cells are at maximum capacity, the excess glucose gets shoved into your major organs.
Into the organs, like the liver and kidneys.
Yeah, your liver, your kidneys, your heart.
Yeah.
And over time, this trapped sugar becomes incredibly toxic.
Oh, wow. Even if your blood tests look perfectly normal?
Even then, that toxicity is the exact mechanism driving long-term outcomes, like heart attacks, blindness, and kidney failure.
So the blood looks clean, but the body itself is toxic. That completely flips how we should measure metabolic health.
It really does.
Yeah.
True metabolic health requires emptying the body's total sugar stores, not just clearing the bloodstream.
Right. We have to actually get the sugar out of the house completely, which requires a completely different approach. So let's get into our section. What can you do starting today?
Well, the most immediate step is to stop putting sugar in. You cannot use drugs to cure a dietary disease. Adopting a low-carb, healthy fat diet turns off the faucet.
And by turning off the faucet, that means eating real, unprocessed foods, obviously cutting out refined fructose, but I imagine artificial sweeteners are a trap too.
Oh, absolutely. If it doesn't look like it did in nature, your body struggles to process it correctly. Artificial sweeteners still trigger hormonal responses that disrupt your metabolism.
Okay, so we stop adding to the pile. But to burn off the excess and clear out the toxic sugar, Dr. Fung suggests intermittent fasting. I have to push back here, though. Doesn't standard calorie counting do the exact same thing?
It's a really common assumption. But no, calorie counting doesn't drop your insulin levels enough. True healing requires fixing a hormonal imbalance, not just doing math.
Oh, so fasting is what actually drops the insulin.
Exactly. When insulin stays low for a prolonged period, it finally signals your body to unlock those overstuffed cells and burn that trapped toxic sugar for energy.
That makes a lot of sense. So treating the symptom isn't treating the disease. True health requires emptying the total sugar stores, which means eating low carb, sticking to real foods, and fasting to reset our hormones.
Better numbers are encouraging, but true health is about changing the process that created those numbers in the first place.
Have you ever focused more on your glucose numbers than your overall metabolic health? Share your thoughts in the comments.
And if you enjoy learning from the world's best health books, subscribe to Mosaic Health 40+ Elvers.
Just a quick note, this content is for educational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment.
All right, always consult your physician or qualified healthcare professional regarding your personal health.
This deep dive was inspired by the Diabetes Code by Dr. Jason Fung and enriched with insights from the author's interviews, podcasts, lectures, and public discussions included in our research sources.
Because better health starts with better knowledge.
Books, science, better health. See you in the next Mosaic Health 40+ deep dive.
It makes you wonder, though, if we've been treating the symptoms of metabolic disease as the disease itself for the last 40 years, what other standard medical guidelines are just sweeping the real problem under the rug?